All right, all right. So I'm always, before I start my session, I want to see the spine. Sometimes you do assessment and test on people standing, but I'm also do assessment when people lay down. I put this ball and bands that's going to be for our thoracic. Today we're going to focus on our thoracic area. So what I'm doing here, I'm visualize. I don't put any bolster. What I'm doing here, I put those toes together. So the toes is touching together, and I see the position of that sacrum. So what I'm doing, I found the sacrum, the posterior sacroiliac bone, and I'm looking for on the same level. Are they same level in sagittal plane and transfer plane? And also, yeah, I'll see this one is deeper, a little bit deeper. This one is pops up here. So what could be that happen if I put the spine? I'm going to put the spine, make sure that I was going to scratch you. So this one is rotated this way, and that one is deeper. So that's mean the whole spine is going to be rotated. What I'm doing next, I'm always go find that lamina and go all the way vertebra by vertebra, and I see where's that transfer is. And what I'm seeing here, this one is lower, so this one is higher, and it's continue till right in here. And in this shift, this one is coming up and this one is deeper. So you see the spine is trying to compensate to make sure if something going on up here, your vision go to your head and you look straight. You're not tilted your head. So that's why there's all this compensation happen. And my favorite one, yes, I'm usually work on that. And what people most time to do, they just try to release that muscle because they see that bulky right side muscle. That's all they do. They just release it, and guess what? Next day, people come back and they get the same tension. Why? Because you never change anything. You release that tension, but it's coming back. The person start doing those exercise or movements, sitting, whatever, driving. It's create this coming back instantly. So what I'm doing here, I usually love this exercise. This is my treatment. I come up here, put this hands on that sacrum, ilium together, so SI joint. This arm is coming right on that one. I'm not grabbing as a hook. So hook sometimes is going to be painful. That iliacus muscle right there, when you try to pointing out, it's going to be painful if you hook. But if you get flat, you go a little bit more. And you see what I'm doing here? I'm roll this person back, David. So I'm rolling back, and you see I'm holding that here. My arms is straight. So I'm not put too much pressure. Some people around it, they doing this. No, I'm straight. I'm leaned back. Now I ask him, David, to push down. Why I ask him to push down? I ask him to activate this muscle and let it go. And I'm doing more, like a kind of jostling, and see how it can go more and more and more. Push down. Good. If I'm lazy, I come up here, get that ball, push against the ball, squeeze. So you see he pushing down and relax. He's activate all those muscles, and you can do both sides, of course. You can do the bands. You can do the wide band. You can slide under. Can you get a little bit of space up here? So here we go. You see, I'm holding up here. I'm pushing with the bands now. I can hold in one arm and doing this. All different type. Push down, relax. You see? Roll, roll, push down. Here we go. And relax. Even this exercise, you see how it's already changed. That bulky muscle is go away. Why? Because we activate this side. Upper body easy too. Go ahead. I usually ask people to scoop down a little bit on the table, and get your arm under your friend. No, go ahead all the way down. No, your head have to be on the table. Yes, just like that. So his hand is in front, and I see a lot of people doing this exercise. So get your arms like this. So like that, he pushing. I can work up here manually. I see people like start doing this. They grab that and they start lift it up. This is kind of a little bit too much, I think. Remember, this side is down. I come up here, and you hold and raise this arm. Push down. Here we go. He's reactivate and let it go. Push it down. Keep this head down. Here we go. Something just pop. Push. I can do the bands, I can do the ball. Remember? Put that ball under, push that down. You see what he's doing? He push. All this muscle, scapula start working. Yes, yes. This is what I'm doing. This is why physio massage. The band is the same. The go band, let me show him with the bands. So he's working, activate front line, posterior kinetic line. Come up on the elbow. And so I'm going to lift him up. He pushing down, push down towards the table. And let it go. I'm release. Come back up again, push down. And release. I can hold it up here. You see, you kind of like doing this. You mobilize that spine. You reactivate everything. Next one, last one, it's called Cobra. Cobra, slide your hands under your on the side. Here, he tilted. He tilt your head. No, tilt like this way. Here we go. So he tilted. I can stay on the top of the table, work both arm. Both like a thumb, I'm driving through the spine, through the lamina. I can hook that fascia with my forearm one side, which is very powerful. I'm just showing on the camera, but I'm supposed to work on that side. You see, I'm grab that fascia, and I ask him to look up and start pull yourself up. You see, here we go. You stay right there, and now I'm stay here. Look up and down. Just move your head. Exactly. You see. And I'm working on that lamina. Both hands, same thing up here. I stay on the side. I don't want to put my crotch in front of my client face. So always see your positioning. I mean, only if he's pay extra. Yeah, here we go. And another one, it's my favorite one. You come up here, you put this band around the neck, right in here, and you pull this so up. And you start choke this client if he's not pay you a good tip. If he's asshole, he teach you how. I'm sorry, this is different class. I'm substitute to the different class. Yeah, don't do that one. But if the client does not tip you or teach you how to do your massage and tell you like, oh, the massage was previous was better than you, or you do some weird stuff, trust me, do that one, the last one, okay? But if client is great and he's appreciate your work, never do that one. All right. You guys have a wonderful day. We'll see you tomorrow and sign up with our class. We're going to do this in November, the manual therapy class. We're going to show a lot of cool stuff. Have a good day. Bye-bye.